I think it's about time. I'd like to respect the people who got here on time and start this meeting relatively close to the starting time. All right, welcome everybody. So today is Thursday, April 26th. I want to thank everybody for being here. We are going to have a series of votes today, so I'm going to need everyone's undivided attention. But we will start, as we always do, with introductions. So I am Matthew Lucier, I am from Village Care, and I am your elected community co-chair. And I'll start to my right with Joan.
Joe Corbacero, parliamentarian.
Thank you. Good afternoon, Darrell Wong, from my planning council staff.
Billy Fields, co-chair of the committee.
Saul Reyes, consumer advisor.
John Jefferson, representative.
Carol Campbell, Columbia Dental.
Good afternoon, Justin McGresty, Consumers Committee.
Good afternoon, Oni Blackstock, New York City Health Department.
Bill Gross from Sage.
Jan Hudis, the Family Center, co-chair PSRA.
Matt Beatty, Mount Sinai Health System, PSRA chair for co-chair.
Stacy Health Council.
Greg Harriman, New York City Department of Health.
Daniel Castellanos, co-chair of the Legal Assistance Committee. Bobby from members.
Bettina Carroll, Public Health Solutions.
Center for Clinical and Behavioral Studies, Columbia.
Faye Barrett, Ryan Center, Chair of Rules and Membership.
Latif Abdul-Haq, Planning Council.
Lisa Best, Planning Council, Tri-County, Co-Chair, Consumer Committee.
Good afternoon, Donald Powell, exponent, member of the Integration Care Committee.
Good afternoon, Joan Edwards, New York State Department of Health AIDS Institute.
Hi everyone, Becky Session, New York City Department of Home Services. Hi everybody, Daria Walters, and I'm IOC co-chair.
Maria Diaz, Tri-County, Co-Chair and Planning Council Consumer Member.
Andy Strauss, Hudson Valley Community Services, Co-Chair Tri-County.
Julie Lahane, Westchester County Department of Health.
Adrian Guzman, New York City Health Department.
Nick Fox, New York City Department of Health, Planning Council staff.
Steve Ramad, finance officer, in the absence of the community co-chair or the governmental co-chair, the finance officer steps in.
He gets to rule this empire with me. Okay, I always forget the phone. Who on the phone is with us?
Christine Allen, Public Health Solutions.
Anyone else? Okay. So, we'd like to start with a moment of silence. Lisa, would you like to enter this body into a moment of silence? Yes.
All right, thank you. We're going to take this moment of silence, and we are all witnessing such trying times, and it seems like some things that we fought for are spiraling backwards. But we've lost many good people along the way. Some of them have sat around this table. And those that are out here still fighting their fight, we want to take a moment to remember that there is nothing about us without us, and thank all the people that are doing this great work. Thank you, everyone.
Thank you, Lisa. Mr. Potts.
Everybody got their minutes. Hopefully, I didn't get any changes. Are there any corrections, changes to the minutes? No, that's Service Center.
Was there any public comment signed up? Okay, so, John, was it you?
Yeah, it's me. Who else would it be? I'd like for the record, in the minutes, can we have like a time frame when the application will be made available again on the site? Because it's been down for a while.
Yeah, it's a
The
technical.
membership
I
application.
can tell you, actually, it's a technical issue. They're working on it. It should be up any day. As soon as it is, I will let everybody.
Marcella? You can go to the microphone.
There's a microphone.
Hi, good afternoon. My name is Marcelo Maia. I'm with ECTA. I'm here to talk a little bit about the methamphetamine epidemic, which is still raging in New York City. Originally, it started affecting people in Chelsea, and now it's all over the city, in all 5 boroughs, and it's affecting more young black men and Latino men, and also transgender women. ECTA started a methamphetamine group about 2 years ago in a coalition, and we are regrouping this coalition. We have a meeting today from 6 to 8 at Harm Reduction Coalition. The health department is involved, the MSC is involved, housing work is involved. So we are looking for other organizations that might be interested in joining us. We are planning a forum. It probably, wishfully, will be at the Schomburg Center. We want to bring the black community and the Latino community, and I think that place is like stuck in between the two. And raise community awareness, provide information for people who use meth, and identify the needs. That's basically it. This issue of a new magazine has Mark as king on the cover. His story is openly about his methamphetamine addiction, how it destroys his life. He had to go back living with his mother after losing his job and housing and everything. It's a common story among people who use methamphetamine. And I'm very scared because they talk about prices going down. If it goes down sufficiently, the methamphetamine epidemic can become a crack-like epidemic, and I think we should be aware of that. Thank you.
Thank you. Adrian? You signed up for public comment, right? Was that you? No?
Sure, I was just going to mention our U community listening session, but I think Graham can mention it in the grantee report, so.
And Amanda, your handwriting is wonderful, Amanda.
Hi, good afternoon. I'm Amanda Love with African Services. So just because in interest of time, I'm going to use notes because I've got some information. I want to talk as briefly as possible, as I can, on the latest chapter of this administration's assault on immigrant families, what it means for HIV-positive immigrants today, and what we as a community can do about it. In late 2017, the administration announced its intention to draft new rules on determining what constitutes a public charge. A public charge is someone who is or who is likely to become dependent on government for basic sustenance. Last month, the Washington Post received a leaked draft of possible changes which indicate that the administration is gearing up to propose changes as to how the government determines which immigrants can stay on the path towards citizenship by expanding the criteria that constitutes a public charge. This shifting of the determination of public charge from narrow to broad penalises not just documented, but also those whose children and families receive virtually any form of public funded assistance or subsidy. This includes school meals, WIC, SNAP, and the Earned Income Tax Credit. For the HIV-positive immigrant community, this means Medicaid, HACA benefits, and ADAP. First, I want to stress that this is still in process and technically nothing has changed yet. The revision, the administration's revision was sent just last week to the OMB for review, meaning we can expect an announcement in the Federal Register for public comments, but more about that in a second. What it doesn't mean is that immigrants, undocumented or documented, will be prevented from accessing those benefits. People would still be able to access those benefits. What it does mean is that if and when that individual begins the process of applying for a green card, if these new regulations go through as intended, it will mean that their application for a green card will be denied because they will have been residing in the US as a public charge by utilizing HACA benefits and ADAP. In effect, qualifying immigrants may have to face the impossible choice between meeting their basic needs for healthcare, food and shelter, or keeping their families in the US. In addition, and what really hasn't gained any traction yet, is that what this also is essentially is a backdoor to reviving the HIV immigration ban. Think about it. Wait, please, just finish. Please. For individuals immigrating to the US, HIV status could potentially enter into consideration as grounds of admissibility because, quote, an alien is a high risk of becoming a public charge if he or she has a medical condition and is unable to show evidence of unsubsidized health insurance, the prospect of obtaining health insurance, or any non-governmental means of paying for treatment. If you're applying for an immigrant visa, either on your own, you've been brought over by your family immigration, you would be denied unless you could pay for all of your HIV care and treatment yourself. It's essentially back to the ban. So in closing, so what are immigration advocates doing and what can we as an HIV and queer community do? New York Immigration Coalition is leading New York state-based advocates in coalition with the National Campaign Protecting Immigrant Families, which is being hosted by the National Immigration Law Center. And as a member of that campaign, African Services has been asked to create a template for public comment specific to HIV-positive immigrants. And we can make that available to you as soon as it's listed on the Federal Register for public comment. So what can you do today, tomorrow? Please take this back to your agencies. Please tread that very careful line of not fear-mongering around this.
Okay, I love you, but I need you to wrap up.
Okay, and collect stories from your clients as to how this may impact them. Speak with your allied organizations serving HIV-positive immigrants. And of course, email or call me at African Services. Thank you for your time.
Thank you. And Amanda, if you send me whatever that model is, I'll send it from my Delishcare account to the council. Thank you.
Thanks.
Okay, so now, Mr. Harriman, are you ready to provide us with a grantee report?
Sure thing. In your packets, you have a grantee report, and I'm going to make a couple amendments to it as I go through it. The final notice award is still pending. We have not received our full award. We received a second partial award, but the full award is going to come late June, early July. HRSA wanted us to let you know that they were at the Synchronicity Conference and shared several different presentations, including making integrated HIV prevention and care a reality, blueprints for cultural competency in Black women's health, and then also HCV testing, navigation, and linkage care with HIV programs. We also did have a number of DOHMH staff who went. We had 3. Seeking Safety, where they presented on seeking safety and the implementation of that evidence-based intervention and harm reduction programs. We also presented on the Recharge program, which addresses the needs of meth-using MSM and transgender women. And then also presented on our Project Succeed work, which is our jurisdictional plan to address the needs of persons who are HIV and hepatitis C co-infected. The Ryan White Services Report was submitted on Monday, March 26th. We had 89 reports for a total of 40,166 clients. That includes clients in testing programs. Our usual number of people that we serve, of people living with HIV, is around 15,000 to 16,000. But most importantly, all agencies met the benchmarks for 6 demographic data elements, including HIV risk factor, medical insurance, federal poverty level, housing status, ART status, and viral load test results. PHS is processing that second partial award that we've received and are notifying contractors of their revised maximum authorization amount. Closeout is underway for the 2017 grant year. It's actually pretty much done, right, Tina? Because I remember seeing an email about that recently. She says yes. Current care coordination. Current contracts have been notified that they're going to be extended through July 31st. We're still finalizing awards for the care coordination RFP, so those have been extended. I believe I've talked before about the Tri-County RFP, which is still in process, but we did have a town hall and a concept paper that we released, and we expect that RFP to be released fairly soon. We're going to have an all providers meeting for the Ryan White Part A program funded providers on May 22nd. And that will give us a chance to cover a number of different topics, including information on care and treatment program priorities, e-shared data mappings, and quality in your data reports, as well as a presentation on U equals U. I also wanted to, as Adrian had mentioned, we are going to have a listening session, and I want to be sure everyone receives this, that we talked about at the last meeting on May 16th. We'll be having a listening session at God's Love We Deliver from 6:30 to 8 p.m. It's really an opportunity to hear from the community in regards to what does U equals U mean to them and to us. How does it change our lives? How does it affect our sexual health? But also, how do people have questions about U equals U, and an opportunity for people to ask some of those questions. So our wonderful Oni Blackstock will be presenting during the day. Won't you? At the U equals U? You aren't going to present? I thought you were going to have like 2 or 3.
Oh, maybe like the intro.
Yeah.
Yes,
Yeah.
I'm sorry. You're totally right.
So please attend. Thank you. Hi. How's it going? Welcome.
Looks like we have questions, Greg. Do you want to take them now or at the end of your presentation?
Questions? Sure.
Tim?
Just to clarify, this 40,000 figure is not unique individuals, correct?
That is unique individuals, but includes the testing programs. So that's why it's so high. It's a lot of like one-time encounters with people who are getting tested.
I think another hand up, was there? No? Okay. Hey, Brett.
I talked a little while ago about the HRSA site visit, and as you all know, we had the HRSA site visit, and HRSA came here to the Planning Council meeting, so I wanted to share just a few elements or pieces of the exit interview that they had with us, and we'll get a full report hopefully soon. They said, I believe 60 days, so it should be coming fairly soon. They had we have a policy manual that we have circulated to contractors. They see that as a strength for the program. We conduct an end of year cost report that was a strength of the program in light of our fee-for-service reimbursement basis. That's an important way of sort of reconciling costs. They would like us to do some more compliance testing in terms of our fiscal monitoring. They were very impressed with the consumer involvement in the Planning Council, and we're excited about the projects and the work of the Consumer Committee, particularly the work in regards to community-based participatory research that you all have been doing. And they encouraged a submission to the Ryan White All Grantees Conference, and I believe that's been submitted, right, Christina?
Yep.
So that's good news. So she followed up on that. Everyone worked together and get that submission in, so that's great. They had some recommendations in regards to updating the Planning Council grievance procedure. They had some recommendations around minutes for the Planning Council, just more detailed minutes. They also had some, they want us to update the Planning Council and grantee memorandum of understanding, so that's good that that work is happening under Faye's leadership. Thank you, Faye. And then they wanted us to think a little bit about our sort of structure in terms of site visits. They also appreciated in the quality management program our quality QI conference, and then they wanted us to report more regularly on performance measures to our providers for quality indicators. So, a full report will be issued, and I can give you more details of that once we receive that.
I want to say for the record, I think these minutes are far detailed enough without them being more detailed. So where they got that from, of all the things they observed, is fascinating. So are there any questions for the great team before we move on? So there are a couple of stragglers who came in who didn't get an opportunity to introduce themselves. So anyone who's sitting at the table who didn't get a chance to say hello? Announce yourself, please.
Paul Carr, Consumer Committee and PSRA.
Asia Bank, community member. Michelle Bacon, New York City Department of Correction.
Katrina? Okay.
Oh, hi. Perfect timing. Blaise Bush, Integration of Care from Calmar Community Health Center.
Hi, Katrina, now IOC.
And on my left?
Also Lopez, local delivery.
Jeff Nett, NYU School of Medicine, Priority 79.
From anything else I got, I started today on the UT Network.
Welcome. And I want to acknowledge someone in the room who doesn't really get much. Oh, there's one more. I'm sorry, Kimberly.
That's right, Kimberly Smith, Cal Nord, PSRA.
Did I get everybody? Okay. So I want to acknowledge someone who we don't see at this meeting all that often, but is sort of the backbone of this process, and that's Judy Kirkham, who's over here in the corner. She's the one that arranges all this. My understanding is she makes the clocks work over at the bureau in this unit. So I just wanted to acknowledge her work and to say welcome. And I also want to acknowledge there are health department staff here in the back. So you guys want to announce, just say hello. Did I get somebody with a chewing? Perfect.
Randall Bruce, consumer.
Christina Rodriguez Hart at Eliza.
Scott Spieler, program planner, New York City Department of Health.
Melanie Lawrence, staff. And this is Isaiah.
Hi, Joe Zai, pharmacist, Liberty Pharmacy.
Hi, Danielle Bowling, White House Medical Center.
John Mead, Special Assistant to the Assistant Commissioner at the New York City Department of Health.
Terrence Gray, New York City Department of Health. Marcel Mayo-Dakta.
Amanda Lager, African Services, where you can contact me about the public comment.
Oh, God. So we're going to have
public health solutions.
Got everybody? Good. Okay. Now we're going to go on to probably the most important section of the meeting, which goes to the heart of why we are here as a council. And so I'm going to turn this over to Matt and Jan for priority setting.
Thank you, Matt. Thank you to all my co-chair Matt Mamie and all members of the PSRA committee who are here today. Thank you for your diligence and your commitment to digging into these important matters and for the really well rounded discussion that we've been having about these issues. As reported at the March Planning Council meeting in February, we had an in-depth discussion about ADAP, and we were joined in that discussion with Christine Rivera. At that meeting, she informed us that New York State will be adding supplemental funds to ADAP, and that as a result of that supplement, ADAP no longer requires the allocation from the EMA, from our Part A allocation to fund ADAP. So for the time being, the EMA can safely reduce its allocation to ADAP, and that then, without adverse impact on ADAP, which means that we can begin looking at what other uses we want to prioritize for those funds. Just as a reminder, it's really important for us to continue to have at least a small allocation or some allocation for ADAP, because we use ADAP as a place where it absorbs underspending as well as carryover funds. And of course, we have to minimize our underspending because anything that's over 5% we lose. And also we use ADAP to balance our base and MAI portions of the grant award. So in March, at our following meeting in March, PSRA discussed the process for how we might begin to look at using the ADAP allocation, or for reducing the ADAP allocation to absorb reductions in the grant award, which we anticipate as a result of the formula funding decreases, and to consider service category enhancements based on previously identified unmet needs. So it's really important, again, to note that our discussions thus far have been really focused on, when we're talking about enhancements, we've been talking about enhancements to portfolios where we've already identified need and where those needs have been fully described in our application spending plans. So, the committee recommends that in FY 2018 and FY 2018 spending methodology to be applied when the EMA receives its full award, which will hopefully be soon, that uses the ADAP allocation to absorb an expected reduction of up to 5%. The reduction is expected to be somewhere around 2% based on the formula. So we're not expecting that the reduction is going to get anywhere near 5%, but there is a cap. This means that we would be coming back for discussion if the decrease to the award is more than 5%. The plan also reallocates some ADAP funding to a long-standing need that's been previously identified and discussed here, which is to add $330,000 to Tri-County housing. This is $300,000 for housing with an additional $30,000 for administration. We also, at the PSRA meeting, discussed using ADAP funds for an increase to food and nutrition services to improve both quality and capacity of those programs. Executive Committee has asked PSRA to relook at this and to consider other possible program enhancements when considering that allocation or that enhancement. So we will be coming back to you hopefully with a recommendation at an upcoming meeting. So are there questions about that?
No.
what we are going to be doing today is we're going to be voting on a spending scenario plan, which will go into the application. No, this is this year, I'm sorry, it's getting my brain is confused here. It's for this year. With the proposal that we move $300,000 to Tri-County for enhanced housing, and that any reductions come out of the ADAP program up to 5%. Is everyone clear on that? Nobody has any questions? We spent like an hour and a half in EC on this. Yes?
Is anybody here that was not at the IOC meeting, the last one we had, that can know what a satellite site is? Does anyone really know what a satellite site is? But you were at the IOC meeting? No. You want to,
Sure.
The reason why I'm trying to ask was the difficulty came up of what a satellite site was, and nobody really had a definition for it.
Okay.
And we went through like the whole meeting before somebody had a basic understanding, and they didn't even know that they were part of a satellite site. Now, when we allocate this money, how much of this money goes to these satellite sites?
Okay, now I get your question.
The money that we allocate is by service category. We don't get involved in deciding which providers within the service category get the money. That is the role of the grantee. What we're approving now is a methodology in advance of when the award comes in, because the fiscal year started March 1st. But as Ray told you, as you've been informed again, these meetings, HRSA has been late in getting our award. So by having a methodology in place in advance of the full award being received, they can immediately implement that. This has nothing to do with which providers get the money, it's just by service category.
Well, wouldn't a satellite site be a service?
No,
it's a location.
Yeah, satellite service is a location of a particular provider.
The reduction in medical case management on Tri-County, did that get mentioned?
That's the next presentation after.
Okay. I saw the 300,000 here, so I was wondering about that. Okay.
Paul?
I was, so when you talked about any other service category changes or recommendations from the executive committee, do you have any examples or understanding what the executive committee came back, sending back to our committee? I'm a little more clarification on that.
There were not specific directives, but rather we will be looking at overperforming categories certainly in that discussion, as well as there was mention of I believe it was in the application spending plan, or it certainly was discussed at PSRA last year, and it came up at EC was the issue around a COLA. So those are a couple of things that are on the table.
But I think the EC didn't, the decision of the EC was to keep this spending plan simple, and so the PSRA can have a more thoughtful, continued conversation and thoughtful process around if there are new resources, where those would go.
So is it, just to say like later on, could we still, even though we were to approve this today, and then later decide what we want to take another $2 million out of the money that we would send to ADAP and like add money to more nutrition or more housing programs? Is that the gist of it?
Yes.
Okay, good. I just wanted to be clear on that. Thank you.
Justin and then Saul?
Hi, on line 10 for New York City admin, the $230K reduction there, is that going to affect planning council services, how we're running, how we're doing things?
So the way the award works is that 10% of the overall award is taken off the top for all administration, and that includes all grantee administration, contract administration, as well as the planning council support budget. So whatever the award is, then it goes down or up concurrently, depending on what the award is. 10% of whatever the award is. If the award does go down by $200,000, then Graham and his staff are going to have to figure out how they're going to apply that. But it's not in the purview of planning council. It's just a 10% automatic taken off the top.
Gotcha, thanks, David. And my second question, something that's been coming up in the Consumers Committee meeting is putting some money aside to send planning council members to some national conferences that are going on. I was just wondering if that reflected in here at all, or is that somewhere else?
That's part of the administration budget.
Thank you.
But, David, we haven't negotiated this year's, no, we did negotiate this year's planning council budget.
We haven't negotiated this year's planning council budget yet.
Because we
Normally, out of that 10% administration, usually about a tenth of that or a little less pays for all planning council operations, including planning council staff salaries and room rental, food, and things like 70 conferences. So we really can't, we don't do that until we know what the full award is, because we don't have an idea yet of what the actual amount's going to be, but we are definitely aware that there's an expressed interest to send people to the All Grantees Conference, especially to present on the Consumers Committee work on quality management. So that would be part of the negotiations. Negotiation between the Executive Committee and the Planning Council chairs and the grantees.
Comment, David. For the future, whenever you explain something in the PSRA, especially whenever you use the word methodology, make sure that you contextualize it when you explain all this, because not everyone is in PSRA, and not everyone it's an old member who, you know, as you speak, it came across as we all here are experts, and so the language needs to be sort of contextualized next time around, next day, but next time around.
We all use acronyms in our jobs, it happens. But yes.
Just wanted to add to the discussion about the Planning Council support budget. It is under development, as David mentioned. There are some new line items that will be including not just the HRSA conference, but the USCA conference. And we're also, depending on the award, looking to pursue our development of the Planning Council website, which, as you know, has been on hold for a couple of years. So we'll keep you posted, and there will be a presentation at some point. The Executive Committee will work with us to negotiate a final budget. Thank you.
So is there a proposal on a PSRA?
Yes, there is. On behalf of the PSRA, I move that the Planning Council adopt the FY 2018 spending scenario, to use the ADAP allocation to absorb a reduction to the grant award up to a maximum of 5%, and to allocate $330,000 to Tri-County for housing.
So there's a motion on the floor. Since Councilman McCready, don't need to second it. Are there any questions on the motion before I call a vote? I'm getting blank faces. So all those in favor of the motion, please say so. Raise your hands. Anyone opposing the motion? Thank you very much. Great job, guys. I know there was a lot of work you went through for that. Next on the agenda, reprogramming plan. That's all for you guys. I thought you were done.
No, life is never done. Good afternoon, everybody. Thank you, Jen, for helping me. We have another vote that's putting forward. This is for the fiscal year 2018 reprogramming plan. The council approves the reprogramming plan every year so that the grantee can maximize spending in the course of the year. The methodology that can be used for many years and has been used is to give the grantee the flexibility to enhance overperforming contracts by moving funds between service categories up to 20% of the original spending.
I know everyone's looking for it's not in our packet, so just, yeah.
You have to listen to me very closely.
We apologize.
This is riveting
It's
stuff.
not in the packet. It was sent out by email. If you had a chance to read it, but Matt's going to read what it says exactly word for word.
I'm going to read it word for word. Let's start from the beginning. This is for fiscal year 2018, the reprogramming plan. The council approves a reprogramming plan every spring so that the grantee can maximize spending in the course of the year. The methodology that has been used for many years is to give the grantee the flexibility to enhance overperforming contracts by moving funds between service categories up to 20% of the original spending plan allocation. This is done after the grantee and PHS enhances overperforming programs from funds taken down within programs from the same service category to maximize the extent possible. Enhancements are one-time and must be used by the end of the fiscal year and usually come in the fourth quarter, and so using them for personnel is not feasible. ADAP is eligible for enhancement after all other service categories have been considered and has no cap. Underspending from the New York City programs is used for the New York City programs, and underspending from the Tri-County programs are used from the Tri-County programs. So that's it in a nutshell. We want to give our grantee the opportunity to move around up to 20% to make sure we maximize the money that we have available. And that does include, as we said before with Jen, that we spend money with ADAP to make sure we get down to as close to zero as we can.
So, oh, great, yes.
I have to say that I wasn't at the executive committee, and so I didn't see the last sentence where New York City programs that will be reallocating within New York City and Tri-County. Is there any more information about that sentence?
No.
I just want to say that it provides us, I actually, 2 years ago, I said that I felt like that was important, but I've noticed that it really is helpful to have the flexibility of rearranging the money at the end of the year to ensure we don't have underspending all throughout the EMA. Doesn't mean that that affects people's money in the next contract year, but it is helpful to have that flexibility. So I'm wondering if we could remove that from the reprogramming plan.
If you want to make a new motion,
I didn't make a motion.
you can make a motion.
Should I make a motion?
Does anybody have any questions on this conversation? I'll ask Tri-County how they feel about this proposal.
That was going to be my question.
Yeah.
We don't have really experience with it, so I guess it's totally to trust the grantee.
Well, it would also mean if you have overspending and you needed money from New York City, that money would be available to you. So it would work on both ends. So it could be a benefit, but it's a benefit to the entire EMA to be able to spend our money most effectively and not have underspending.
That's fine.
Sure.
Okay, so with your understanding that we will take out that last sentence, the last sentence reads, underspending from the New York City programs is used for the New York City programs, and underspending from Tri-County programs are used for Tri-County programs. So we are striking that from our proposal, and we would like to say on behalf of the PSRA, I would move that the council adopt the fiscal year 2018 reprogramming plan as presented.
Any questions? Does everybody understand what we're voting on? All right, everyone's shaking their heads yes. So, all those in favor? Except for the phone.
They're calling in. It's very important.
Anybody opposed? Okay, thank you. Now you are officially done, guys. Thank you. I'll move on to Tri-County.
Okay, hopefully this will move just as quickly. So I want to thank the Tri-County Steering Committee and also the Planning Council staff for steering us through what has been the work of us many months. So thank you. In preparation for the rebid of the Tri-County portfolio and funding year 2019, the Tri-County Steering Committee has been working on a revised set of allocations. We talked about this at the last meeting. After months of data review and discussion at the March meeting, the Tri-County Steering Committee approved a spending plan for funding year 2019. The 2018 portfolio remains stable with the addition of $300,000, actually $330,000, to the housing services allocation as described in the PSRA committee report. And on the, you can see that in on the spreadsheet that we have, and it's line E, and 2019 plan reallocates funds from the medical case management category and uses those funds to increase the food and nutrition category by $170,165 and to fund the new emergency financial services category at $250,000. The decision was made after careful review of data on duplication of case management services and payer of last resort issues in the Tri-County region, as well as unmet need in the food and nutrition services and the emergency financial assistance. So that addresses the question that came up earlier. The increased allocation for food and nutrition services based on waiting lists and existing food programs and the average cost per client per year. For emergency financial assistance, the committee used an estimate of the amount that would be needed for personnel administration, the number of clients estimated to be served, including those in waiting lists or unable to be enrolled in the one small privately funded program in the region, and the Planning Council approved cap of $2,000 per household per year in the Emergency Financial Assistance Service Directive, and the fact that many clients will not need the entire amount. Tri-County programs, which are now cost-based, will be performance-based after the new contracts are in place in 2019, which means that the steering committee will be able to make adjustments to the allocations based on actual performance as the programs are implemented. So I'm not making a motion yet. But have questions?
I'll take that as a no.
Yeah? Okay, I'll make a motion. On behalf of the Tri-County Steering Committee, I move that the Planning Council accept the funding year 2018 and funding year 2019 Tri-County spending plans as presented.
Any questions on the motion? Oh, this is an easy crowd today. It's wonderful. All those in favor of the motion? Anyone opposed? Thank you. I know that was much easier than the previous committees. Don't threaten me. Okay. We're now going to move on to our policy guru here for this council, Adrian.
Hello, hi everyone. I'm Adrian. I'm the Director of Policy and External Affairs for the Health Department. And I just want to spend a few minutes on some topics related to your work. So first, I'm very excited to mention that in June, the New York City Health Department will be convening all of the HIV and STI policy point persons across the city to sort of come together and share our respective local, state, and federal policy agendas to the extent possible around legislation, regulations, and other policies, and also just to really brainstorm ways that we can work more closely together. Not that we already don't work very closely, but we think it's very important to really ensure that all of the health department's work is informed by what's happening at all of our CBO partners' work when it comes to policy. So that will be in June sometime, and if you have any ideas for organizations you think would benefit from joining such a convening, let me know, absolutely. I think that we have a pretty solid list of organizations, but we're always interested in other collaborators. And I want to mention that I'm working with my counterpart in the Bureau of Sexually Transmitted Infections, formerly known as the Bureau of STD Control, and they just successfully changed their name. So the reason for that is obviously so much of our work, our respective work, align and overlap, especially since the blueprint, of course, and we think it's important to have that voice at the table. And also, I just want to brag about you guys to him. We have such a strong community partnership, a strong policy partnership, and I think that we can really make change in other health domains. So be on the lookout. We're excited about that. I'll let you know about dates and times once they're settled. Second, I've mentioned many times, but one more time, it's probably not one more time, I'll probably continue to mention this, but as you know, back in the spring of last year, New York State finalized some regulatory amendments that allow minors to consent to HIV prophylaxis and treatment without parental consent or notification. So on the next slide, I just want to mention that in our efforts to promote this regulatory change, in June, the Health Department is leading a Prep for Adolescents training workshop for the New York City Department of Education school-based health centers. These are in many, but not all, middle and high schools across the city, and they generally have 2 staff members each, a medical provider and also a support staff. So we figured that this is an excellent a pool of youth-serving providers that we can work with and make sure that these regulatory amendments that allow minors this opportunity, that they know what's happening. So we'll talk about the history of the blueprint, the regulatory amendments. We'll highlight HIV surveillance data here in New York City among young people, and we'll also have a strong Prep 101 component about screening young people, how to refer young people to our Pleasure Network providers, as well as our sexual health clinics, and talk a little bit about our 3 Prep for Adolescents clinical sites that we fund across the city. So we're planning a similar workshop for ACS, for Administration for Children's Services, for providers that work with young people who are in one way, shape, or form involved in the child welfare or juvenile justice system. So just another example of how we're promoting to the extent possible all of the changes that are happening at the state level.
I just have a question about
Sure.
it said the medical and billing records won't be accessible to the parents. So does the insurance company know just to flag the service to not generate an EOB? Like, what is that?
Right. So this
like
is
on
this is
paper?
the change that's the rub. This is the policy change that happened. It's not necessarily the entire record. Ideally, it would be, but in the law it says it's because it's in the law, a section of the law that relates to this specific information. We can assume that the portions of the medical record that relate to this consent wouldn't be shared. Now that's on paper. How it's being implemented is another story. So certainly we're working with the state to determine how to best work with insurance agencies and also the Medicaid and marketplace exchanges to figure out how to do that, because it's going to be a different approach for every different provider of insurance for young people and their parents.
Yeah, that's the concern, because
Yes.
you go to the doctors and 4 weeks later you get an EOB. What is that EOB going to say if it doesn't say access to prep services?
There's some, so I listed, you probably can't see it there, but on your slides, hopefully you can see a bunch of sources. These are resources that the state has put out, and they provide some guidance on how to address the EOB issue. Because it's not just EOBs, it's also any kind of documentation that might get to a parent policyholder that could, in one way, shape, or form, imply that there have been some services that delivered to the young person that the young person might not be interested in having their parents know about. So I'll let you know if there's additional information from the state.
I just wanted to ask a question following up on that. You know, we're talking about line wide money. This might be a great question. So I'm just asking this question, and please forgive me if it sounds ignorant because I'm not sure about this. But aren't our plans or our grants and things like that, how would that impact us? Because if somebody has the ability or has insurance, aren't we required to build that insurance if in fact they have it at all? So we couldn't write this off, could we, if we were doing a grant under Ryan White?
Someone asked us at the state conference, actually, and part of the answer was if you're accessing PrEP services, you're not covered under the Ryan White grant because you're not living with HIV. And then in STI treatment, yeah, it's kind of how a state's Medicaid handles those kind of claims.
So, one question. You said you are inviting school-based organizations,
school-based health centers,
and ACS. What about organizations like Brightpoint Health, who has a large pediatric clinic?
Then you'd be next on our list, absolutely. This is a brand new training we're developing. So actually, that's a really good point. As soon as we do these first two, it's not the end of what we want to do. We have the materials, we're compiling everything we want to communicate. So if there are other ideas, perhaps agency-specific, or in one way we can bring everyone together to deliver all this information, let me know, because we're absolutely ready and willing to take the show on the road.
I think agency-specific might be useful because within one organization has, like for Brightpoint Health, has a huge pediatric network within its network.
Excellent. I'll take that back for sure.
Ruben and Donald? So I have a question. I don't know your evaluation tools for these workshops, but I think it would be great to see as a committee, like comfort levels of this community before and after the workshop, how comfortable they feel talking about PrEP with their family or between friends, comfort levels, intentions and perceptions. That would be great data that we would like to see.
It's like I was bugged yesterday in the meeting. That's exactly what we talked about, and making sure that there's a really strong evaluation mechanism. So if you have some ideas, if anyone has some ideas about that, definitely email me. I can connect you with our clinical operations technical assistance staff that's developing exactly that, pre and post intervention eval.
So my question is actually prompted because I'm sitting here looking at the back of Michelle Baker's beautiful head. Was there any consideration to bringing in DOC staff, DFY staff?
At the state level?
City.
At the city level. So we're working with ACS to target first foster care agencies and the affiliated medical providers. So when it comes to working with the DYFJ side of things, we're going to be reaching out to the detention side of the agency and work with them. We've been working with the Office of the Medical Director at ACS, so this is just the first in a series of conversations we'll be having on how we can work with ACS, for sure. Now, at the state level, we haven't had any conversations with them where we will, for sure, absolutely.
And I only mention it because I know that on Rikers Island there's a whole complex just for young adults and adolescents, GRVC, and I'm sure they're getting medical attention there. So if those providers could be a part of that training, I thought it might be beneficial.
So next is Jeff. Oh, sorry. Jeff and then Faye. Jeff.
Hi. How can an organization become a part of the Glacier Network if they're not a part of it already, as a specialist provider?
Express interest in it. Yeah, absolutely. We can email me and I'll connect you with our the whole program that would be able to provide some context on how to get more involved.
Thank you.
That's a really good point too. We should really talk a little bit next time perhaps about the Glacier Network and what it does and how interested agencies can get more involved, especially adolescent serving agencies. Great. So
one question.
Sure.
This. So are we also, I guess this will be the next step in speaking with Gilead and the FDA to make sure this is approved on their end as well, to get this medication for minors?
I mean, we have the same brain. We are waiting with bated breath. From what I understand, they had applied for the adolescent indication for PrEP, and somebody said, the word on the street was that there would be some decision on it in the first quarter of 2018, which I think was about 3 weeks ago. So we're waiting, we're eager. We hope to hear some news about ensuring that PrEP as HIV prophylaxis for young people isn't just off-label. So, fingers crossed.
One question. Currently, if someone is undocumented or underinsured, uninsured, ADAP would pick up. If someone don't have insurance, period, they would get ADAP to pay for the primary care, the labs, and so on. Then we have to do the application to Gilead for the medication. Would, for minors who might be undocumented, would ADAP pay the ADAP for minors?
So one of the, I think that I broke.
And can't cover not many individuals, that's a challenge.
One of the resources that I list there is the state put together a whole sort of FAQ specific to billing for both adolescents and adults. And I know that we have, as the city health department, have some supplementary material on that too. So we can circulate that as well.
So we're only on the second slide.
I'm glad I read. So I won't spend too much time on the next 3 slides, but if you remember at the last meeting, like mere hours before I did my presentation, Congress finally passed and the President signed the omnibus to fund our government through September 2018. So I did mention it, and I'm sure you've heard about it in the last month, but I did want to sort of lay out there in the slides information about it. And on the following slide, and the one after that, there's just a breakdown of how we fared so far with the FY19 appropriation. So that's just for your benefit, and the links and all that are on the bottom. So on the next slide, I wanted to mention something you also may have heard about. Congress passed and the President signed into law an anti-sex trafficking bill. On February 27 and March 21, the House and Senate respectively passed the Allow States and Victims to Fight Online Sex Trafficking Act, and the Senate versions the Stop Enabling Sex Traffickers Act. The bills propose amendments to federal law to ensure liability of providers and users of computer services under criminal and civil laws related to sex trafficking. So, critics of this, I can't say bill anymore, of this law, claim that the vague language includes no guidance on enforcement, meaning that this could have the effect of extending civil and criminal liability, not to just those platforms that host sex trafficking and sex traffickers, but online advertising platforms that may be used to promote consensual work. There's just not a clear distinction on who exactly liability would be imposed upon based on this law. So, it goes without saying that the law may drive individuals involved in the sex trade away from online activity and towards street-based work. So that is of interest to anyone, but specifically to the Planning Council in terms of this is a group that may now have increased vulnerability to violence, to exploitation, certainly to HIV and STI risk. So this is something to keep an eye on to the extent we can. The President signed the bill into law in April, and I believe even before he signed it, you may have seen it on the news that like Craigslist took down its dating misconnections portion of its website. A number of other, Backpage.com, which was involved in the litigation that sort of prompted this. There's not much to say except that this bill had overwhelming support in Congress, including our own state senators. So it's out there, and how one responds to it is another story, but I wanted to put this on your radars.
Before you move on, I know you have a question.
Yes.
No, actually, to complement what he said. So it actually, just to put it for you quite clearly, so the transgender sex workers in Jackson High, I spent last weekend with them talking about that particular issue. And so, yes, it will be a return. Actually, they have returned to walking the streets in larger numbers. I saw it. And as a consequence of the bill, and that would imply as well that more risk will be involved with not only police, but also health-wise. So, yes, it's already there.
So for people who are more interested in this issue, on June 2nd at Christopher Park across the street from Stonewall for International Sex Workers Day, they're actually doing a rally and a protest at 2:30. They said bring your red umbrellas because the Red Umbrella Project is a symbol for sex work. And it's about protesting no more criminal legislation like FOSTA and SESTA, no more strip parlor or massage parlor club raids, no more walking while black and trans arrests or attacks from cops and violent clients, no more incarceration for self-worker self-defense.
June 2nd, you said.
June 2nd at 2:30 in front of Stonewall Inn.
Thank you.
Keep going, Adrian.
Two more updates. So this also occurred just a bit after our last meeting, but I wanted to mention that back in March, you recall Grindr announced that the app will send users to opt into the service, to opt into service reminders to be tested for HIV every 3 to 6 months, and will direct them to the nearest testing site. A couple days after that news broke, BuzzFeed News reported that Grindr had been providing some of the information that users included in their profiles, including their HIV status and their last tested date, with Optimize and Localytics, two app optimizing companies. So all within a couple of days, lots of backlash, a lot of advocacy. It actually resulted in Grindr announcing that it would stop sharing information about its users' HIV status with third-party analytics companies. So this actually wasn't against the law. It was an opt-in sort of thing where the fine print said that any information that you include in your public profile could be shared. I'm not sure how many people read the fine print generally, much less when downloading apps, but it was there, and fortunately, to avoid any kind of further backlash, Grindr did say they would stop sharing
Seems like not only Facebook is guilty of sharing people's user data.
It's all shocking. I never expected any of this. The last update I have is very exciting. You may have heard that Democrats introduced a $100 billion piece of opioid legislation, which is modeled on the Ryan White CARE Act. This has been rumored for a couple of weeks, but it was last week when Senator Warren and Representative Cummings introduced the Comprehensive Addiction Resources Emergency Care Act, which would provide $100 billion in federal funding over the next 10 years to treat the opioid crisis as a public health emergency. And it's like 100 pages long, and I got through some of it, but it's modeled almost entirely, well, almost completely on the Ryan White CARE Act. It would establish a comprehensive set of funding and local decision-making rules to address addiction and substance use. To give you an example, some allocations, $4 billion to states, territories, and tribal governments, $2.7 billion to the hardest hit counties and cities through, similar to Ryan White, formula and competitive grants, a good amount for public health surveillance research and training public health professionals, and also some money for expanded and innovative service delivery, and to expand naloxone access among first responders, health departments, and the public. And what's really cool is that it actually builds into it the requirement to have a planning council, just like this. And the types of stakeholders that the planning council would be required to have is actually more progressive and forward-thinking than the Ryan White one, 30 years later, but it's still impressive. I don't want to get your hopes up. It's two Democrats, and it's $100 billion. And we're not in a political climate in which the federal government is allowing localities to allocate their dollars left and right. So it's more of a statement, Phil, but I think it's gotten a lot of conversations happening, and I will definitely keep you posted if there's in fact any opportunity to move this forward.
Yeah, I noticed Senator Warren and Cummings, not the most conservative members of the Senate, and I'm not seeing Orrin Hatch on there or anything like that we have with Ryan White. So
that's important to mention. Thank you.
And don't forget, Kellyanne Conway is going to be here.
We're going to go on the committee updates. So I'm passing the baton to Steve.
Can I mention one thing in regards to a previous conversation about the feasibility study? We're actually waiting, hoping for de Blasio to do the right thing.
Aisha, we're going to get to that in a minute once we do our consumers update. Don't you worry.
Okay.
So, next item on the agenda is the Consumer Committee. Billy, Lisa?
First of all, I'd like to introduce
my new co-chair to the Consumer Committee, Lisa Best, and she will be reading personal.
I do want to say I went to the Consumers Committee last week, and when Jen and I were trying to think of who would be a good fit to be chair, Lisa came right to our mind, and that's a rowdy bunch. It's like worse than cats. Hey, I'm a lot three at that table, so. And I have to say, the two of you ran the meeting really, really well, and so congratulations on running your first meeting very smoothly.
Well, thank you very much. You might be sorry by the end of the year, but no, I really want to take this time that we are here at the body. I really thank all of those involved in their vote of confidence, and I'm hoping that I will step up to the plate. Thank you for your words. So I am going to begin the Consumer Committee report for April 19, 2018. The Consumer Committee met this Tuesday afternoon. Katrina Ballow-Winkler resigned as the Consumer Committee co-chair, and the new co-chair, Ms. Lisa Best, was introduced to the committee. I just want to take the time right now just to say to Katrina, thank you for your work and your everything that you put into it, and I hope I can fill your shoes. But we, from the Consumer Committee, we really thank you. I'm very happy at this point to announce this very encouraging piece that relates to HRSA. As Ms. Morgan from HRSA has described, the HRSA site visit team attended the March Consumers Committee. In their closing statements, they shared their observations, which reflected that the consumer's passion and commitment demonstrated on both individual and group levels is palpable. The committee demonstrates a level of organization and sophistication in its approach and is unparalleled nationally. Dramatic pause. The Planning Council's annual evaluation of the administrative mechanism is an opportunity for stakeholders to weigh in on programmatic accountability. There will be follow-up on issues raised and will be addressed in HRSA's follow-up site visit report. While site visits are now scheduled every 4 years, there are now open lines of communications for consumers to weigh in with HRSA on an as-needed basis. It is at the, yes. I would like to now take this portion of the consumer report and turn it over to the co-chair, Billy Fields, who will also be including the motion to the Planning Council. Thank you.
Thank you, Lisa. The Quality Improvement Ad Hoc Workshop Group Subcommittee also met on Tuesday, where Dr. Katina Rodriguez Hart, the Planning Council Epidemiological Liaison, led the discussion focusing on consumer solar system and quality improvement projects and the 9 ensuing recommendations. Strategies moving these expanded recommendations to our state for inclusion in the Master Service Directory were explored, including the convening of consumers, providers, experts, and the grantee to continue to flesh out the recommendation. The abstract has been submitted to HRSA for the conference. The Consumer Committee description appearing in the Planning Council bylaws was reviewed, noting that the new description needs to better reflect the goals and ongoing activities of the Consumer Committee, which centers not only on outreach, recruitment, and support, but also the increased focus on quality of care, quality improvement issues, as well as increased synergy with other Planning Council committees. The final version will be submitted to the Rules and Membership Committee for their review and approval. Finally, noting the delayed release of the City Council Commission report on safe consumption site commissioned by the City Council, the committee made a motion which was approved to request that the Planning Council pass a resolution requesting that Mayor de Blasio release the long-awaited report on safe consumption sites in New York. That is our updates. So the motion was brought to the floor by committee member Paul Carr.
Can you bring the motion to the floor now?
Okay. We will, on the Consumer Committee, yeah, Paul, why don't you do it? Your motion.
All right, I motion that the Planning Council adopts a resolution calling on the mayor to release the SIP feasibility study. Right here.
Why don't you restart over and just read the resolution?
The Consumer Committee calls upon the New York HIV Planning Council to pass a resolution calling for Mayor de Blasio to release the City Council funded feasibility study on supervised consumption sites.
Well, I just wanted to mention, we talked about the report, I mean, we've been talking about the report at quite a few Planning Council meetings, but I mentioned at last month's meeting that after months and months of advocacy, the mayor finally publicly announced his intention to release not only the report, but his positions on the report in April. So I know we have 2 business days and an hour left in April, but I would discourage any kind of Planning Council action calling on the mayor to do something that he's committed to doing before he has done it. I wouldn't mention anything. Also, I think it's important to remember that our biggest ally in this is the City Council. They wrote the check. They commissioned our colleagues at the Health Department to issue the report. And one of the reasons the mayor finally identified April as when he will release the report is because the city council and the speaker wrote a very strongly worded letter demanding that he do so. So the city council has our backs in terms of getting this report out. I just worry that despite the fact that you are mayoral appointees and possibly because of the fact that you're mayoral appointees, I don't want to see any kind of relationship with the planning council and the mayor complicated if we ask him to issue, or demand to issue the report when he still has time to issue the report. And again, this is all in the context that this is a report that probably should have been released quite some time ago. But I wonder if it would be more effective to discuss a motion, or at least plan to issue the motion.
I think first of all, the motion on the floor, now to see if it gets seconded, and then we could go to a discussion.
Well, for process, it says it come out of the committee, don't need a second on the motion, because it's coming from the committee, so it's already, motion's already on the floor.
Asia? Yes, I did. Respectively, I understand, all what you're saying, I understand all that. But de Blasio is doing nothing but playing games with us. He does not want to release this study at all. We showed him the data, we showed him the proof of fact. The police department, the NYPD police department, went out, they recently went on a trip to one of these safe injection facilities.
To Toronto, yeah.
Into Toronto.
I read that too.
You understand? So it's, we're in his face, we're showing him the proof, he just does not want to do it. And not only that, we asked him, where does he stand on it? And he doesn't stand with us.
The only thing I just add, maybe a slight change to the amendment, is just to hold off on sending it until next week.
Yeah, he's supposed to do something in the next 48 hours.
He has until the end of the month. If he doesn't send anything, we have an agreement that we would send it in May. That's the only, so I think the motion is to say a specific date.
Then it could be through the conditional resolution. Yes.
So are you amending your motion?
Yes, I'm amending the motion to say calls upon the New York HIV Planning Council to pass a resolution calling on the Mayor de Blasio to release the City Council funding feasibility study on supervised consumption sites, conditional resolution, if it's not released by April 30th to take effect on May 1st.
So there's a motion on the floor. Any other discussion? There's a motion. All those who are in favor?
As amended, right?
As amended.
Opposed? Motion carried.
And when the report is released, I think maybe we could take some time at the next meeting to really go through it and walk through exactly what it says and get feedback and then absolutely feel free to communicate that to the mayor, the city council, and to the health department who authored the report. We can certainly maybe take a few minutes at the meeting following the release and we'll walk through it.
I'll let you know if it happens.
1, 2, 3.
Yeah, I just wanted to add, in respect of what you had also just said, if we can do maybe a little more than take a few minutes and maybe make it a new business item.
We'll put it on the agenda for a future planning council meeting when it's released.
I have a question about the safe injecting sites. Are they supposed to be medically supervised, and will they be providing a whole host of medical and psychosocial services to people that may utilize that?
We're actually working on how it's actually going to go. Of course, it goes to funding, how much, funding you need, because basically at safe injection facilities, we already have people there. So there are people in place, but yeah, it's going to be linkage to service, and there's going to, hopefully, we're going to be able to have a medical staff on board.
is that this has been a proven model for some 15 years in Europe where they do have medical supervision. But also, I just want to put that the reason I brought this up is because the mayor's had this since November. If you do the math, it's about 5 months, so about 7 people, was it every 7 hours? 7 hours. Every 7 hours, and roughly, we're talking about 450 people have died to this. So we have the opportunity and proven methods that we can prevent future deaths.
So, next item, community outreach recruitment.
Sorry. Mr. Booker, I know maybe it was around November, whatever, we had people here that gave a good presentation on safe sites. Maybe when the report does come out, maybe they can come back and reintroduce that presentation, bring everybody back up to speed and more familiarized with what's going on.
We'll definitely be happy to come back.
Okay, so the next is needs assessment.
Hi everyone. This month, the needs assessment will be made and review the integrated plan, and particularly the indicators for the next year and perhaps several years. And something that was stressed was, there were two things that were stressed on these indicators. One was a co-infection, being able to track co-infections, in particular hepatitis C. And the second thing was to take a closer look at those groups that have been impacted the most. So that information is collected, it's already collected. The selection is to stress the emphasis on, and put some additional emphasis on those two issues. The next meeting in May continues the work that we have been doing looking at HIV among transgender women. For the last 3 months we have been having different meetings. The first one we had presentations on AP data and service data, and then we had some service providers talking about provision of services. In May, we have extended the meeting to 3 hours, usually it's 2 hours, so it's been extended to 3 hours because we want to do is invite a broad set of people who have been working on HIV among transgender women to come to the table and talk about these issues. Something I want to stress is that the New York State has also done some work. There are some work groups. What we want to do is also look at our service categories and look at our portfolio and to see what services we are providing and what recommendations we need to provide for us, for the right and wide contracts, but also for the broader service landscape. It's very exciting to have a very diverse group of people coming in May. The list is changing a little bit, so I would like to, Melanie, if you can mention some of the people who are coming.
Hi everyone. So we have Callan Lord is coming back, and they're bringing a few more people to talk to us. We also have Cecilia from GMHC. Thank you, Paul. She's confirmed. We have Levi Solomon from the GOH, and we have the folks who developed the ETE TG recommendations that Carrie worked with. I think they focused on Manhattan, which is a really strong set of recommendations. But I'm glad that Daniel tapped me in because I have sent out a flyer with like little tags to remind people, but we really want to hear from the people whose lives are impacted. So HIV positive transgender women of color are especially encouraged to attend. If you know anyone who is able to come and speak and share, we would love to have them. There will be translation services for Spanish language available. If you need other languages, please contact me. Hopefully you all know how to get in touch with me, but if you don't have my contact information, anyone on the Planning Council, any of the Planning Council staff can reach me, and many of the Planning Council members know how to get in touch with me as well. Or just tap me in. Also, I wanted to say that there are really amazing events that are constantly happening, like within your organizations that are peripheral to the Planning Council work that have to do with the DOH. And so we started something called a hoot board. I'm gonna go handle that in a second. Something called a hoot board that we have set up in order to post that kind of information, because a lot of times we receive information and it might not be something that we can send out on our listserv. It might not like fit within what we typically send out or what we try to send out. And so it's a forum, just like an electronic bulletin board for you guys to share that information. And so this next needs assessment committee meeting is posted, and as usual, all of our meetings are public. We serve food at all of our meetings, and there will be 2-trip Metro cards available for all consumers at all of our meetings, including this one. So if you could spread the word, I would really appreciate it. Is that good, Daniel?
Yes, thank you. Two things to stress. One that Melanie said, please invite people to come that day. We really want to get as many voices into this process. What we want to do is that by the end of the summer, to have a set of recommendations on transgender women and HIV that pertain to our Ryan White.
Could someone post a flyer that could be made to post in clinics and service organizations about the meeting?
Yes, I think that Melanie sent out the flyer, so we can. Yes. Yeah, absolutely. The second thing I want to say is thank you, Melanie. Your work has been amazing.
So, in addition to the event on May 10th that has been announced and sent out, distributed to the Planning Council, we wanted to announce that on May 17th, the following week, that the Queens ETE is meeting specifically on that day in the evening, where they're convening a town hall or a leaders meeting of transgender persons from Queens. And specifically, it has to do with Queens. This is part of the Queens ETE blueprint recommendations that Saul has been involved in with the state. So that's also an opportunity, and we're inviting any Planning Council members, and particularly needs assessment members, who want to hear the perspectives from transgender persons of color living in Queens, because as you know, it's a geographically dispersed kind of community that tends to stay in its own respective areas, and Queens has largely been not part of that conversation on an ongoing basis, and Saul can add more.
Jeff?
Melanie, how can we get information about this food board?
I'll note that question for her.
Yeah, I'm going to send an email to our entire mailing list. She just sent it up literally today.
Oh, okay.
So you have to register. It's very simple, and you'll be able to post things about events and job posting, job openings, things like that. And we're going to send something out to everybody to subscribe and do that and access the postings.
Thank you.
So just to add and be helpful, again, there's a need for a flyer to be in Spanish as well. I've seen, and in addition, and I've been telling you this for the past several months, any flyer it would be helpful that any flyer you put out includes the wording safe space.
This is important for the trans community, this is important for the immigrant community. I spoke with Melanie, it still hasn't sunk in, because the last flyer doesn't include it. And this is important when you're trying to reach the transgender community that is immigrant as well. I'm very glad Condor is participating. I spoke with Ishala yesterday.
Okay.
I'm glad that hopefully CHN is involved and all these other organizations. But I think if you want to hear from the individual experience, I think you need to stretch out to more grassroots organizations like Transgredida, Transgrediendo, they are a sex work group, and support groups run by ACQC, run by CHN, run by all these organizations. Let us not, my advice is that perhaps the view you have of what you have access to or want to invite is still skewed by providers and the access we have as planning council. You really, if you want an in-depth look, I will suggest those things.
Thank you. Since you are also part of the needs assessment committee, it would be great. Reach out directly to Melanie and give them some context that she can follow up.
Okay, thank you. Integration of care.
Hi, everyone. So the Integration of Care Committee has been working hard for several meetings, trying to prepare for working on a new revised Food Nutrition Services Directive. We're continuing that process. We have received a great deal of data and presentations. We've heard from providers that are currently funded as well as providers outside of the Ryan White portfolio to understand the food nutrition needs and food insecurity and malnutrition and food desert needs of the individuals that we all serve. So there have also been some tours of some of the agencies that are currently funded, and we want to continue to understand what is it that we would like to implement in a new service directive, given some concerns that may exist in terms of potential funding cuts, in terms of SNAP benefits or anything like that. We want to make sure that we give voice to that when we are creating the service directive. So our next meeting is going to be on May 16th, and it will be a full working meeting, very comprehensive. It's another 3-hour meeting. So if you're on needs assessment and you're on IOC, get ready. And hopefully we will, have be moving forward in actually creating draft language around that service directive recommendation. Because our hope as chairs is to really move that process along so we can get it in front of the planning council before the summer break, which we don't know if that's going to happen, but hopefully that is something that we can just put into process. It's going to happen. Yes. Declare it, receive it. Sure. And otherwise, everyone's been very great on the IOC. We're very excited to have learned all of this, and now we can kind of get to work.
Lisa?
I just need some clarification just for myself on the consumers and agency tours. Is this specifically NYC initiative, or is this something that is going to be extended, and what do you have to do to be part of the consumer tour?
So my understanding is this is the first year we have done tours of organizations. Normally the IOC does not do that. So this year, we just kind of followed the lead of our grantee staff, our planning council staff, in the sense of the agencies that we've visited. But we also have reached out to some of the other organizations. Many of them came to present to us, and actually came with consumers as well. And many consumers have been attending each of the last probably 3 meetings. So our hope is to continue to expand the voices that we hear from so that we have an understanding as to how individuals that are currently accessing services, how that process is, Is there enough? Are they able to access SNAP benefits? If an individual is an immigrant, they're probably not accessing SNAP benefits. So how to make sure that we're understanding all of the potential audiences that would need that service. So I don't believe we'd be able to, we didn't have the timing to be able to visit all of the currently funded organizations, and that's something that we really regret. But we also understand that we can continue to understand or visit those agencies even after we started working on the service directive, because I think the group really realizes that what's happening now isn't necessarily what we are going to be held to. We're trying to plan for the future and guide the grantee in terms of what we think is important for them to consider when creating a new RFP.
I should also just want to clarify that the Integration of Care Committee works on service directives only for the city portion of the portfolio. The Tri-County Steering Committee creates the service directives for the services in the Tri-County region. So the Tri-County region has an existing food nutrition service directive that was approved a couple of years ago, which is in place.
I thank you for the explanation, though. I appreciate it.
Okay. Rules on membership.
Hi everyone, this is Faye Barrett. So for our rules of membership, the Planning Council, what we have been doing, we've been reviewing attendance, and for this go around, we are sending 3 letters to members who have, three individual letters, to members whose attendance has been out, they have not been attending, out of compliance, they have not been attending the Planning Council meeting. That's one. We also have been working on the Memorandum of Understanding. That is something that we're working on right now. And because it's such a large document, we will be meeting twice a month for the next few months to try to get the revision of this document in, because it's a lot of steps that need to take place before the final document can be completed. It's going to take a few months.
If I may, as a member of the committee, if there's any lawyers in the room who want to join this thrilling process for reviewing a legal document, I'd love for you to come to this meeting.
Oh God. And then also, so I know someone mentioned before about we're looking to start the recruitment. So I know someone mentioned before that the application process, if the application is not online, but we don't have to wait for the application to be online. If you see someone, know someone, refer someone, okay? We don't have to wait until last minute. We can do the referrals now. We don't want to be scrambling. So if you know of people, please do the referral. You have David contact, a lot of my contact. You can start the referral for individuals who you think that will be a great candidate for the Planning Council. Thank you.
Also, you can send any prospects to Jose Colon Verdecia, and his contact is on the left, on the masthead on the left-hand side of the calendar, because he's our outreach coordinator.
And I just want to see, so everyone has the May calendar in your packet. The next meeting will be on May 1st at GOH. You guys are definitely welcome, since we're going to be reviewing the MOU. Such a fun time.
Okay, new business. Public, any final public comments?
Hello. Hello. My name is Joel Zai, and I'm a pharmacist, and our pharmacy has an interesting program for high-risk food insecure patients. If any of your clients or patients need PrEP or PEP and they're food insecure, we will supply 56 cans of Ensure to them at no charge. There's no requisite for that, and all you have to do is just write on a prescription food insecure, and we'll take care of it. Oh, and I have information if you need them. Oh, sorry for my season.
You don't get to take it home.
Jeff?
Hi, I handed out a flyer to all of you about a workshop that we're going to be giving Bellevue, NYU, Youth and Young Adult Specialized Care Center. We have a series of monthly workshops that are open to the community, people that are HIV positive or anybody that's interested. The next workshop's coming up on May 10th, Thursday. It's focusing on people that are re-entering the workforce or entering the workforce for the first time and what they should consider in making a decision on how many hours to work and how it can affect their housing, insurance, and other benefits. It's free. Metro cards are provided to consumers that need them. There'll be light refreshments. I gave you all a flyer. I also have a calendar here of all of our workshops through the end of November, and I can give that out to you. And again, these workshops are free and open to the public. Thank you.
Thank you. We have one final sign of public comment, Ronald Brooks.
I have a question. Where did he go? He left, Adrian. My question was when, but I'll propose it to you all and you can relate to it, whoever can give him the question. He made a statement saying that they will be only doing in certain schools the public, they will be only having it in certain schools where the younger kids can get the information they need on PrEP and PEP. Now, my question is, if they're only doing it in certain schools, and one school has it, and the kid from that school tells somebody else that from another school, we have this, and they ask, how can I get it? And it's not in their school, what happens to the kid who wants to get it? Because they're not going to allow him to go to another school, to come into another school to get it. That's my question. That's about it. Leave it at that.
Okay, motion to adjourn. Any other business? If not, motion to adjourn.
Well, it's before 5 o'clock, so when we say let's adjourn, watch out for the lightning.
I want to congratulate this group. We're actually finishing before 5 o'clock, so thank you.